Hey Cam followers, because that's what you are now, because this is episode 3, which means that you're still with us. So today we are going to talk about how to make the best of being, visiting your vet, to get the most out of that consult room, that time, their attention, because it can be really difficult for both parties. I've been a vet nearly 18 years now. How long have you been a vet?
19 years, only 1 year more than you did.
But we've both experienced how difficult it can be in such a short space of time. So why don't we just give some tips that's far off what we would suggest to them as an owner to do, maybe in advance, on arrival, and during the room.
Yeah, so in advance, have a think about what it is you want to say. If it's absolutely fine to write them down and go in with a shopping list. I do that when I go to see my GP.
I think it's
go in with a shopping list. Although you don't want to drive the conversation too fast because you have this list to get through.
Yeah.
If your vet's only got 10 or 20 minutes with you, then focus on the thing that's most important right now. If his vaccines are due in 3 months' time, don't worry about that.
Yeah.
That's for another occasion. You want to talk about the fact that your dog seems to be struggling to get on the sofa or has refused to jump in the car.
Or behaviour's changed on a
Some
walk.
things change. So you want to focus on that, and you want to focus on the fact you think it's because he might be painful, because you've been watching
this amazing YouTube channel.
So go prepared. When you get there, if you have to sit in the waiting room, then definitely talk to the receptionist, because we're in the business of training receptionists to recognise what's going on with your dog as they watch you and your dog in the waiting room.
Yeah.
If you're worried about him being a bit slippy on the waiting room floor, then you take something with you for him to lie on. If you've got a really forward-thinking veterinary practice, they might actually have
some yoga mats or something.
Mats out that your dog can lie on, because when he tries to get up from lying on that floor, he might skid around. So where I work, we've got a terrible floor.
Have you? It's a difficult one. I do feel for vets because we have to keep squeaky clean. But also, squeaky clean means slippery, and slippery is really hard for dogs with disabilities. So take something with you. If not, on your visit, just mention to your vets, have you ever thought about having some yoga mats that my dog can lay on?
Cut down yoga mats, yeah. So when you go in to see the vet, then ask them if they don't mind if you leave your dog on the floor rather than lift him up.
Yeah.
Your vet may hopefully will be completely happy with that.
Very receptive.
Ask if you can let him off the lead, let him relax a bit in the consult room, maybe take some treats with you that you know he'll like.
Yep.
So you can try and get him to relax a bit, and try and have that conversation with your vet before he or she even actually tries to examine the dog. Obviously, you are not completely in charge of the situation, and some vets will go straight to wanting to touch your dog, and other vets will stand back and let you talk.
It's a bit of an art. So, I've worked in about 50 practices around the country now. Don't judge me, it's planned. And everywhere that I've worked, people are different, and they have different approaches. And that's something quite beautiful about veterinary medicine, is you develop your own skill and your own art. So no vet is going to be the same, but you do know your dog best. So you are allowed to guide that vet. And if your dog is going to be fearful on the table and you think, yes, actually, I would like my dog to be examined on the floor, you can request that. Obviously, do it politely. Don't go, oh, do it on the table. Say, would you mind if my dog stayed on the floor? And the vet should be receptive. And again, in a really forward-thinking practice, they might even have a non-slip section that they can put down so that your dog can be examined on the floor without slipping and sliding. Something I wanted to add is, many practices now are receptive to you sending an email in advance. So if you have a list and you're a little bit concerned that you're not going to have enough time, you could pre-send an email and say, these are the things I'd like to cover, just so that the vet knows what to expect. We do have an OA booklet that you could take with you, and it gives you a chance to fill in a few things before your visit, so you go a bit more prepped. Video clips on your iPhone, so useful for us. By the time the dog has arrived at the practice, they're generally quite alert, and at that point they're likely to hide those subtle signs of pain, and they will go into cope mechanism very, very well. And that vet's at a very big disadvantage, so you're explaining to them something that they have no hope in seeing. And they'll do the physical examination, and that dog will go, just get it over and done with. I want to go home. And they'll go into a completely inhibited state where they're just like...
But you've also, what I often find is that a dog will come in bouncing, very excited, and trying to jump up and lick my face. And I know, well, one, actually that's probably also anxiety, but the dog's showing it in quite a different way. But that dog's giving me no clues of how he normally finds it to walk around, because it's overcoming the chronic pain. This level of arousal, which can be positive or negative, excitement or fear, is actually overcoming the general discomfort they're feeling. So it can be really difficult for a vet to ever see your dog in apparent pain, which is why it's so your observations from at home, including potentially video material, is so important, because the vet never gets to see that. Even if the vet does a home visit, you're a visitor, you're exciting, the dog's likely to be perked up by your presence. So home visit's great, but it's not the solution completely. Your observations are what's most important.
And they don't just end at that first diagnostic point. They are imperative through the whole course of the disease, which might be months, if not years, that your observations are so important. And we're going to come back to that in later episodes to tell you how to use them with best effect. So please stay with us for that. But just going back to that consult room of you getting the most out of your vet time, because we all know time pressures, expense, busyness. Go in with the list, go in with video material, pre-send an email. Don't get your dog all highly strung before arriving. If it's better for your dog to stay in the car until the actual consultation, that might be possible. Your practice might have a bench outside that you can sit quietly. Think about how your dog is going to find that visit least stressful as possible. Take them in quickly, take treats to give them comfort and confidence and comfort. Examine them on the floor, ideally. With regards to your vet, you should expect them to listen to your observations and take your history. I would then expect them to do a clinical exam, and that is quite complex. They'll be doing a clinical exam, a pain exam, an orthopaedic exam, a neurological exam, all combined into a very short space of time of touching, feeling your dog. So allow them to do that, but you should expect them to be handling your dog. And then they've got to bring all their conclusions together, explain it to you, type up your notes, and get you on your way.
They might even ask for you to come in again so they can have a longer appointment with you.
Yeah.
If you've had to squeeze into a 10-minute appointment, they might say, actually, this is going to take longer. Can I book you in for a double session tomorrow or next week?
Yeah, totally. So what we're going to do is we're going to leave that there, because we're beginning to delve into diagnosis, which is another episode. So what we're going to do is leave there, speak to you in episode 4 about what you can expect from a diagnosis. So we will see you then.